Brad Williams, Frugal Finance, Medicare. Medicare is a requirement for those 65 or older. Well, here's the deal. Okay, you need to sign up. Whether it's a requirement is entirely up to you. If you're wealthy, I doubt if you're going to go down this road. But Medicare, the foundation of Medicare is fantastic. Understanding Medicare is complex because the government wants to make it complex. Here we have this summary overview, but the bits and pieces of Medicare are complex. And I have comprehensive video on crossing the T's and dotting the I's and understanding Medicare. But this is just a quick overview, and there's a lot of resources here by Medicare.gov. Why do I use this information instead of writing this on my own? Because this comes from the source. So some of you are going, Williams, there's nothing original here. Well, the idea is to consolidate all of this under Frugal Finance as a one-stop resource, okay? So they've got a video over here, and they have a bunch of other helpful tips. But as I said, you're going to have a bunch of different parts, but understanding the parts to get to the final conclusion is a little difficult. You don't want to read the last 4 pages in a fictional book thinking you got the answer by reading the last chapter. You hear it's comprehensive, and you need to constantly keep an eye on the changes in order to reduce your costs and retain the same coverage. With that being said, parts of Medicare, you have Part A, which is hospital insurance. Part A helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. Part B is the medical insurance. Part B helps cover services from doctors and other health care providers, outpatient care, home health care, durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment, many preventative services like screening, shots, vaccines, and yearly wellness visits. Part D, drug coverage. Part D helps cover the cost of prescription drugs, including many recommended shots or vaccines. You join a Medicare drug plan in addition to original Medicare, or you get it by joining Medicare Advantage plan with drug coverage. Plans that offer Medicare drug coverage are run by private insurance companies that follow rules set by Medicare. I'll go into this in detail. Medicare supplemental insurance, Medigap. Extra insurance you can buy from a private company that helps pay your share of costs in original Medicare. Policies are standardized, and in most states, named by letters like Plan G or Plan K. The benefits in each lettered plan are the same, no matter which insurance company sells it. So you're going to find, and I'm going to point this out to you, how if you signed up for Plan G and you have Aetna, you have Blue Shield, you have Cigna, you have United Health, and Blue Shield was charging it for $90 a month, and United Healthcare was charging it for $400. They're the same plan, and I'll explain why you need to go with the lower cost if you're getting the same thing across the board. Your Medicare options, when you sign up for Medicare and during certain times of the year, you could choose which way to get your Medicare coverage. There are 2 main ways. You have the original Medicare. Original Medicare includes Part A and Part B. You could join a separate Medicare drug plan to get Medicare drug coverage, Part D. You have to join Medicare, Plan D. Otherwise, they're going to penalize you. You can use any doctor or hospital that takes Medicare anywhere in the U.S. You can also shop and buy supplemental coverage that helps pay your out-of-pocket costs, like your 20% coinsurance. Then you have this horrible Medicare Advantage, also known as Part C. And I'll get into why this is not the best plan. I know if you have a source of income, Medigap is the way to go. And I'll explain why as we move on, or you check out my other videos. Medicare Advantage is a Medicare-approved plan from a private company that offers an alternative to original Medicare for your health and drug coverage. These bundled plans include Part A, Part B, and Part D. In many cases, you can only use doctors who are in the plan's network. Plans often have different out-of-pocket costs than original Medicare or supplemental coverage like Medigap. You may also have an additional premium. Plans may offer some extra benefits that original Medicare doesn't. What's the difference between Medicare And Medicaid, Medicare is federal health insurance for anyone 65 or older, and some people under 65 with certain disabilities or conditions. Medicaid is a joint federal and state program that provides health coverage for some people with limited income and resources. Now, there's a lot of ways to work this if you're somewhat savvy and you have the resources. You can use a trust mechanism to qualify for Medicaid, even though you have resources. The rules are the rules, and if there's a way to work the rules in without breaking any violations, a lot of people do it. Medicaid offers benefits like nursing home care, personal care services, and assistance paying for Medicare premiums and other costs. If you qualify, you can have both Medicare and Medicaid. Learn more about Medicaid here. You can check out my videos on that. And what do you do next? Costs. Check when and how to sign up. Learn how Medicare works. You can check all this out yourself. You can check out my videos. Comment, let me know what your concerns are regarding Medicare or Medicaid, and I'll try to address them. Brad Williams, Frugal Finance. Thanks for watching. Hope that helped. See you soon.